everyone. Welcome to Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Sweta Singh, our Chief Administrator, will start the session.
Hello everyone, myself Dr. Shweta Singh, Chief Administrator. Our respected speakers, Chairman and CEO, Kavita Ma'am, volunteers and all the attendees to webinar. I would like to take this opportunity to introduce Homeopathy Study Group to all of you. Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, KA. This study group is intended to be an offering from Kavita to the homeopaths around the globe. Sharing goodwill and solid clinical work within the classical model are foundational principles for the KA. KA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy, and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is also the associate editor of the Homeopathic Heritage and member of CHC PR Committee and Achina CPD provider. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, Ex-Director Homeopathy, Government of Uttarakhand, and Chairman of Homeo Cure and Research Institute during National Homeopathic Seminar Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Deepak Sharma, Ka Executive, Dr. Rajneesh Sharma, Ka Advisor, and myself, the Ka team, were also recognized and presented with Legendary Homeopath Award at the ceremony. We are extremely happy and proud that we celebrated 11 years of her book, Beyond the Limits, a challenge to prove oneself. And at KA's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched audiobook and hard copy of her second write-up, A Dose of Spirituality with Kavita. Dr. Kavita donated the proceedings of the book through KA study group platform to various charitable organizations and homeopathic association. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, BT Seva, NCH, etc. Interested one can reach us for details at kastudygroup@gmail.com. Purchase link will also be shared. As of now, we have over 300 plus recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by Ka family, myself, and Dr. Yashika Arora, Ka volunteer. It is being recorded as we speak, and we will take the questions at the end of the webinar. We will also post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your certificate of participation. Kindly mute yourself and turn your video off for better connections. Let me introduce our honorable speakers to all of you. We have with us today Dr. Hiralal Aggarwal and Dr. Nupur Shah. Dr. Hiralal Aggarwal is a homeopath practicing in Solapur at Sri Ram Homeopathic Clinic and Research Center and has an experience of 40 years in this field. He completed LCEH from Dhondu Mama Sathe Homeopathic Medical College, Pune, and in 1982, and Diplomate IACH from International Academy of Classical Homeopathy from Greece in 2000. He's a direct student of Dr. George Vitholkas And our second speaker, Dr. Nupur, she pursuing her MD in homeopathic pharmacy from Swastika Kalyan Homeopathic Medical College and Research Center, Jaipur. She completed her BHMS from Udaipur. She is a senior consultant at Orbit Clinics, Joint Secretary at Delhi Homeopathic Medical Association, DHMA, and she is the volunteer at Kavita Holistic Approach Homeopathy Study Group. So today we will learn about pain management with homeopathy from our honorable guest speakers. So I welcome both of you to KA platform. Welcome Dr. Hira and Dr. Nupur Shah. Now let me welcome our first speaker, Dr. Nupur, to proceed with her session, which will be followed by Dr. Hira. Thank you so much. Dr. Nupur, you can please start your presentation.
Hello everyone. So we are going to start with what is pain. So pain is defined as unpleasant sensory and emotional experience arising from actual or potential tissue damage. The word pain derives from the Latin word peonia, meaning a fine, penalty, or punishment from God. To know the pain better we can understand by the colder, which is mnemonic. Uh, colder stand for character, onset, location, duration, exacerbation, or relief. So if we talk about the character, so what is the character? Basically in this we define the types of pain. Types of pain including the quality or the description of the pain. So in types of pain, we are basically concerning about the character. So there are many types of pain: biting, boring, burning, cutting, clawing, jerking, paralytic, pinching, pressing, stitching, tearing, twisting, rending, and lot of. So repertory defined in very beautiful manner. I have took this from the generalities from Kent repertory. So in biting, the high grade remedies are carboveg, nux vomica, sulfur, zinc. Boring pain includes argentum nitricum, aurum metallicum, belladonna, bismuth, pulsatilla, spigelia. In burning pain, there is apis, arsenic, aurum bryonia, causticum, murk, natrum, phosphoric acid, rustox, silicea, sulfur. In cutting, belladonna, calcarea, conium, drosera, petroleum. Extra, we are having lot of fun, and maybe the character of the pain better defined in our repertories. uh, by the onset of pain, we understand it can be gradually or it can be sudden. So if it is sudden, then the character of pain uh, is acute or fast pain. If it is gradual, then chronic or slow pain. Location of pain better understand by the human anatomy. It could be visceral location pain, parietal or referred pain. Duration of pain is defined by the time. So either if it is in initial stage, like last for few seconds or initiated within minutes, or last for hours, days, or months. So if it is for seconds or minutes, it can be acute, and if it lasts for days or months, it can be chronic. Exacerbation of pain can is the aggravating factors by which it can be occurred. Like after any injury, the patient started the pain, or due to any mental trauma, it can be started, or due to any of the reason which cause or which aggravate the pain. relief, basically ameliorate or better by like some patient can get better by warm application, some can better by cold application, some can be better by walking. Like this we can understand the colder. So here I am discussing one case which covers both acute and chronic. So the cases of subserosal uterine fibroid. So a patient came with a lower abdomen, and she is just 23 years old, unmarried female. First time she came on 6th July with the pain in lower abdomen and pain just suffering from since 2 months. So that onset character is suddenly, which lasts for 10 to 15 minutes, and pain reduces towards the leg. Pain aggravated by the pressure, urination, motion. Motion basically while riding on bike or scooting. Backache aggravated by standing. There is peculiar sensation as if something is moving inside the abdomen. She keep on saying कि there is something movement which I feel when pain aggravates. In past history, she was diagnosed fibroid in 2022 and took homeopathic medicine for this. She get relief up to when she continued the medicine. Whenever she stopped, again the pain aggravated. But from the last few months, she was taking homeopathic medicine, and the physician prescribed too many medicines with different potency at the same time. Like she was taking Staphylococcus 200, Maxfox 66, Colocin 200, Apis 200, and even many more. She told me I was taking these medicine, but nothing significant happens to me. So and she also took homeopathic medicine for her acne, which 3 years back, and now she is better. There is no acne, face is clean, no eruptions, and in any other body part. So physical generation, appetite is good. She eats 4 chapatis in morning and 4 chapati in night. Thirst, thirst is 3 liters per day. She desire for sweet. She crave for sweet. Stool twice daily, satisfactory. Urine, she told that when pain aggravates, she cannot hold the urine. Holding urine can bring the pain and bring the pain, and which is unbearable. Perspiration on back, she said. Sleep is increasing, feel sleepy all the time. Mental generals, aggravation, anger is very anger towards their own persons, but she is calm at their working field. So anger is always aggravated by consolation. She want to be remain silent and want to be quiet and don't want to talk to anyone. Fear of dark, prevalent desire. When inquiring all the symptoms, she said she is dominated by father due to her study conditions, as she dropped out BTech at in the third prof, because she don't want to do she don't want to study. She want to open her own business and set up her own business. So by this, we came to know that she is fixed. She is fixed at their own thought that she had made the mind ki, I want to do this. So I uh, I don't want to study. So at this age, she is running her parlor, and she opened in 2018. She is very dictatorial towards her work, and she, uh, she want to dominate the other one person, but she is dominated by her father. In menstrual history, the cycle is normal. 28 days cycles last for 4 to 5 days, partially in clots. She told that she has white discharge per vagina, which is offensive, thick, and whitish in color. Before menses, she has pain in breast. So in general examination, height is 155 centimeter, weight is 55 kg. She is anemic. Jaundice, jaundice, cyanosis, and edema is not present. Skin is healthy, moist. Nails, there is no brittle, no whitish or no clubbing nails. Lymph nodes not enlarged. Pulse, BP all normal. On systemic examination, there is marked tenderness on the lower abdomen and around umbilicus. So there is quite impossible to check further, but there is some hardness seen on the right abdomen. So on the treatment part, first I prescribed Seclec only starting the case because she was already taking so many medicines, which was not according to homeopathic law. So I gave her Seclec 30 TDS for 10 days. Uh, she came she came on 10th July. The pain was worsened and unbearable. She can't bear the pain. So on the acute totality, I gave belladonna 200 sublingually in globules only, 4 globules sublingually at one time at the interval of 15 minutes. And after two doses, she told that she is little bit better. And by evening on telephone, she told that she don't have pain right now, as she was having continuous pain and which sudden and last for 10 to 15 minutes, followed by cyclic 30 days for 10 days. On 20th July, she came and said she is better for first 3 days after taking belladonna. So better in pain. Even she told that while traveling, the pain she was feeling while on motion, that pain was also better. There is no jerky pain felt by her. White discharge get better. There is no offensiveness noticed by her. So no other changes seen. So I prescribed Seclec 30 for 10 days. On 31st July 2022, there is slight pain, pain was better, backache better, white discharge better, but she is having bloating and acidity. And also she said she is having dribbling of saliva during sleep. So I thought the case is fine, and it is just the due to belladonna or she is getting relief. So I again prescribed Cyclic 30 for 10 days. So on 13th August, pain continues for hours and pain is localized to ovarian region. She said the pain is now continuous and locally she pressed on the ovary region. And whenever she says they on pressure even, she is aggravating the pain during urination. She is having the pain. There is profuse salivation during sleep. There is no food taste. She always says ki no, there is no taste in my food during last few days. So after repertorial, I took mind dictatorial in this condition. Female genitalia, pain ovary pressure aggravation, pain ovary urination during, pain ovaries, pain stitching, mouth salivation, profuse night, taste in insipid food taste. So in last taste insipid food taste. So we after repertory we got Thuja. So we gave Thuja 1 m, and Thuja is prescribed as it is psychotic psychotic in origin. So I took Thuja, gave one dose stat followed by Saclex 30 for 15 days. So after 15 days, she said that she is uh, better in lower abdomen pain. Also better she can pass urine peacefully. She felt feverish after taking the dose. In the initial after second day, she felt she is having fever, but it subsides itself in a day. So she doesn't took any other medicine. Dribbling of saliva is also better, but she said that apathy appeared. She is having apathy in her mouth, especially around the lip region. So also mentioned that earlier she was having something is moving. That sensation also got removed. So a Seclec 30 given for 15 days. After 15 days, she said that she is better. Taste improves. Apathy also better. White discharge, but this time she said she is having slight offensive white discharge. Again, Seclec 30 given for 15 days. After 15 days, she said she is better and pain comes, which is for few seconds only. There is no, and it can be negligible. So there is no change in white discharge. Again, she kept on Seclec. After 15 days, she said she is having better, no pain seen. White discharge also improved. There is no offensiveness. She kept on Seclec, and she came this week and advised for the USG, because the USG report is of January 2022. Till now, there is no USG report, and this is the running case. So we can manage the case, especially the pain, both in acute and chronic phases. So we have to understand what basically pain triggers. Like belladonna is written in everywhere. Yes, it is for sudden onset. But why belladonna? Belladonna basically covers. It its main constituent is atropine, which dilates the nerve ending, and which give the relief to the suffering. And puja is given as the miasmatic and constitutional remedy for her disease. So this is the case. Thank you.
Thank you, Dr. Nupur. It was really a wonderful case you have shared. And now I invite our second speaker of the day, Dr. Hiralal Aggarwal, for his presentation. Welcome, sir.
Shall we start? Shall we start?
Yes, sir. Please.
So first of all, I welcome all the delegates that have been present today. And I'm also thankful to Kavita, our chief coordinator of all this platform. She is an inspiration behind this whole platform. Does not work, but you can see the whole team is working because of her inspiration and energy. She is the energy behind us, and she is always jubilant, very caring and helpful. So I'm thankful to Kavita for giving us this opportunity to share the today's discussion. So as Nupur had said, the definition we are trying to learn pain today and how it can be managed with homeopathy. So before we understand management, we will have to understand what is pain. So it is an unpleasant and emotional experience associated with or without actual tissue damage. There can be a tissue damage or there cannot be a tissue damage, but it is an unpleasant emotional experience. But it is a protective mechanism of the body. Whenever body is getting some signal from outside, it tries to give you signal in the form of pain, and that is a protective mechanism so that you will be diverted to do something for it. Now pain has become a global health priority because it has been increasing tremendously. It estimates 20% of adults suffering from pain globally and 10% are diagnosed each time and every year. Pain affects all populations regardless of age, sex, income, race, ethnicity, or geography. It is not distributed equally across the globe. It may be less at some part, it may be more at some part. Pain can be acute, chronic, or intermittent. 4 largest causes of pain are cancer, osteo or rheumatoid arthritis, surgical or operations, injuries, and spinal problems. Pain has become a complex transdisciplinary affair. It cannot be managed by one thing. It has been a transdisciplinary affair. Pain has multiple serious sequelae, including but not limited to depression, inability to work, disrupted social relationship, and if it is very severe, it can give rise to suicidal, even suicide, because they are unable to manage their pain. So types of pain, already Nupur said, but a little bit more: acute, chronic, referred, central neuropathic, peripheral, or visceral. Now we see what they mean. Acute pain is described or defined as a pain which has come suddenly and it persists up to 3 months. They are coming and going and it persists up to 3 months. After 3 months, it becomes more of a chronic pain. It is normal, predicted physiological response. It serves as a warning signal. It alerts the tissue are exposed to damage. It is mostly localized and it is directly proportional to the stimulus. I don't have to go in much detail about the discussion about these sentences. Now, chronic pain, it persists more than 3 to 6 months. Pain continues after the stimulus is removed or tissue damage heals. It continues after the tissue damage also heals. Results from hypersensitization of pain receptors and enlargement of the receptor field in responses to the localized inflammation that follow the tissue damage. It is poorly localized. The phrases of sensitivity, hypersensitivity comes into role here from homeopathic angle. Referred pain, pain location other than its origin. Referred pain is pain of location is other than its origin, follows specific pattern, results of a convergence of the primary efferent neurons from deep structure and muscles to the secondary neuron, and also has a cutaneous receptive field. Central neuropathic pain due to primary lesion or dysfunction of the CNS. The levels are at nerve level, nerve root level, central pain pathway in brain. Onset may occur due to phase of recovery from neurological deficit, post-stroke, post-paralysis, all these things. Peripheral pain due to noxious irritations of nociceptors, depends on the intensity of stimulus and types of fibers carry the information in the dorsal gray matter, that is A, delta, and C. If you can go into the more details about how pain is been transferred, then you have this A delta, C delta, and all these things. That is a different chapter. It may take an hour to discuss how pain is transferred or transmitted from brain to different centers in the body. Autonomic pain, it arises from the abnormal activity with the ANS, example CRPS. Visceral pain, it results from the activation of thoracic, pelvic, or abdominal viscera. The pain is diffuse and difficult to localize. Very common that we come across in our practice: appendicitis, gallstone, or pelvic pain. Now, what are the measurements of pain? The pain should be measured. If you want to do some research or if you want to understand what is the measurement of pain. So there are various scales that have been discussed. The very commonly seen are VAS, NRS, and VRS. Now we'll see what is VAS, is visual analog scale. It visual analog scale. It is, as the name suggests, it is the facial expression to represent different types or levels of pain. So there are facial, the patient with the face, or when is deep agony, the patient is crying with pain. The amount of hurt gives a facial expression, and this is how from 0 to 10 you can understand or define the pain. That is again a numerical pain. Here the patient says, when you tell them what is the rating of pain on number 0 to 10, they will say, I can grade my pain. But this is more for logical people or intellectual people who can really understand and tell this numerology. Fourth is verbal rating pain. Verbal rating pain or verbal pain intensity scale. No pain, mild pain, moderate pain, severe pain, very severe pain, worst possible pain. These are mostly given by illiterate people, or where there is miscommunication or where there is a language barrier. They will say it's very painful. If you try to press that point of inflammation, then it's more of a language situation rather than real communication. So whenever language becomes a problem, this pain intensity scale can be taken into account. Now, common sources of pain worldwide, according to Global Pain Index, common are what we come across: headaches, musculoskeletal pain, visceral pain, period pain during menstruation, and toothaches. Now you see, pain has become a very difficult situation nowadays, and it has various impacts on the human being. First is the physiological impact. If you see the physiological impact, %61% suffer from pain weekly or more. It's a periodicity more. 75% say their pain is quite or very severe. 55% are pain for at least several hours. So physiological impact on the body, how much time they suffer the pain. Now emotional impact. The emotional impact, the pain makes them moody. When they are in pain, their mood changes. 42% say that there is a negative impact on themselves and they cause low self-esteem. They feel, why me? They say, why me? Why I'm always taken for pain? While 47% say that their pain makes them anxious. There is a lot of anxiety and fear on the emotional level when they are in deep pain. And quality of life, most important, quality of life. 83%, you see, 83% of people say that there is a negative impact on their day-to-day life, their day-to-day work. Now people are running day and night. They cannot waste one single day. Forget about single day, single hour also. And that is one where that is one situation where during pain, people adopt allopathy. Take an injection of pain and run to work. Take a painkiller and run to work. They cannot sustain a day's leave. So they take a painkiller, maybe injectable or orally, and go for work. While 72% people say that their pain decreases their QOL. QOL is quality of life. Their quality of life is much disturbed because of the pain. Now, because of the pain, there are self-management strategies. Take pain medication, rest or sleep, physical therapy, movement, stretching, exercise, massage. So, if you see, 60% of people take pain medication. As I said now, take an injection, take a painkiller and move. Some go to rest or sleep, 48%. 25% do some physical therapy, movement, stretching, exercise, massage, yoga. 25% of people seek medical advice, and 23% people take a non-medication action, application of hot and cold needle, hot and cold therapies. Now, why self-management is helpful? Why people opt for self-management? Why then they don't go to the doctor? Because self-efficacy, the pain is controlled and you become more of self-efficiently. You can move for work, you can run for work, you can do your urgencies. So you become self-efficient. And then who take pain management immediately, they feel more of control of pain than those who wait to treat. It means your confidence level increases. I can manage myself, I can do myself. This is how the level of confidence increases. While 3 and 4 said that they could control their pain better than others. I wish that I could have controlled myself by myself the pain more. Because of the mobility being increased, you are being more productive. You become more productive in your work, and thus your work does not get hampered. And that is why self-management of pain is more important. Now, treatment options for self-management pain in therapy. Orally applied medications. You see lot of housewives, Iodex maliye kaam pe chaliye, a common, that is how it came up. Iodex maliye kaam pe chaliye. Using of Iodex, Amrutanjans, all these pain balms, pain killers. Then you have pain killer patches. TENS are the electric stimulation that is done, occupational and physiotherapy, and orally consumable medications that are you get over the counter medications. Now, alternative treatments. Now, if you go into treatment part, what are the alternative treatment that remains? Use of a medical device, that is heat patches or cold patches or TENS, that is the electrical stimulus. Take a herbal remedy. Kade, ukade, you take much of kadas and all. Seek an alternative medication like acupuncture, osteopathy, or TCM, or take a CBD oil or a CBD oil based treatment. In CBD oil based treatment, even homeopathy medications are being dropped or put on and then taken as. The percentage is also given. 11% seek medical advice, 10% herbal remedy, 9% alternative medication, and 6% take a CBD oil. Now we come to, I hope this is a base of where we can see now what is the ground for homeopathy. Homeopathy in pain management has been called a breakthrough of complementary and alternative medicine. It really has a very good breakthrough in the TCM, complementary and alternative medicine. But there is a but it is left out and unnoticed. Many reasons for that. We are also one of the reasons for homeopathy not coming for the forefront. Now, why? What are the advantages? One, it is, as always known, it is safe and cost effective. Very much cost effective. Highly cost effective. It's more potent and many times works faster than an injection. You put a dose on the tongue, sublingually or on the tongue itself. Immediately you can see the changes that can see in the pain. The child sits up or the pain in the abdomen just vanishes. Can complement for those who are already on conventional medicine. So in chronic cases where people like rheumatoid arthritis, osteoarthritis, they are on painkillers already, it can complement those conventional treatment also. It does not interact with their medication. Rather than when you start your homeopathy, you see that their painkillers are reduced. What they were taking 3 or 4 painkillers per day, they come to 1 painkiller per day or 1 per week also. Does not interact with any other medicine. If you are diabetes or any other things that your medicine does not. I hope my voice is clear. Nupur,
Yes, sir.
Kavita. because there are some changes in the internet
Okay.
connections.
It's fine, sir. Please
Can heal
proceed.
other health conditions. When we biggest advantage of homeopathy is in chronic cases when we give our remedies not for the pain but for the disease for the person, it can help other conditions at the same time which are having more side benefits than side effects. You are giving your medicine for rheumatoid arthritis, the acidity also goes down, the skin itching also goes down. So other health conditions which a person is having, our same medicine can help those because we give an individual remedy. So it is having more of side benefits rather than side effects. It reduces need without danger of dependence or withdrawal. Most important is the dependence of allopathic medication. Our medicines does not make you dependent. You are never dependent on medicine because finally you are cured or you are much better. Helps those who are of agony of withdrawal or to contain suffering and secure recovery. So now somebody wants to withdraw medicine. So there are a lot of withdrawal effects. If you add homeopathy, that agony of withdrawal, the withdrawal symptoms don't come or they are much less. Our medicines have no names. They don't change. In or Baralgan before have lost now. Now you have something spasma proxy-1, that also gone. Spasmindon, that has also gone. Meftal spas has come up. So the changing trend in allopathy, what is seen from years, you cannot see in homeopathy. The same belladonna 250 years is there, the same belladonna is still working. So there is no change in the generic name, nor dependency, nor difficulty with homeopathy. Now, ways of treatment. What are the ways of treatment in homeopathy? One way is a standard protocol. When is the standard protocol used? In emergency situation or in case where a virulent infectious disease, where the nature of trauma of infection imposes the same set of symptoms pattern on nearly everyone. This we see in the chikungunya infections. Now, whenever a chikungunya infection is there in a whole of the area, you see mostly Brian, depending on the modalities, depending on the atmospheric situations, a very common remedy, Brian Rostox comes up. Or whenever there is a fall, history of fall, we straight away give arnica, whether it is a head injury or whether it's a back injury or whether it is a hand injury. Wherever there is a broken bone, you give symphytum and you give calcareophos. Wherever there is a injury or sprain to the connective tissue, we generally work with rutals. So these are the standard protocols, or these are the remedies which are mostly or very commonly used. So this is a standard protocol way of treatment. Now, why this standard protocol is used is it helps to speed healing and reduce pain for common regular problems, trauma, preoperative or postoperative. Preoperative also for the pain, for the teeth, dentition, after removal, hypericum, staphysic area, they are all very commonly used. Don't need much of analysis they are doing. Or temporary palliative. The second way is temporary palliative, where we choose the remedies from their clinical effectiveness or therapeutics. Whenever we see therapeutics, when we see seat of action of the remedies, and we use those seat of action for temporary palliative. The patient has come suddenly, sir, kuch to dijiye. Patient is coming with the pain, tooth pain, and holding the hand like this. What will be the remedy? You have to give immediately. You don't have to ask much questions. Mersol will be the remedy. Or you see the tooth is totally carried at the center crown, staphysic area, at the base, thuja. So seeing the remedy immediately, temporary or palliative way. And the third or the final authority is the must be customized to the individual patient in chronic conditions. So customization or so these are the ways of treatment. Now dispensing and posology. How should we give and what should be the posology? Posology is repetition. Now, if symptoms are very severe, the medicine can be given more frequently. Many times what I do during high fever or severe pain, we add the dose, one dose in half cup of water, and every hour we have to sip 1 teaspoonful out of it till the pain subsides. Especially with biliary colic or kidney colic, renal stone colic, you have to give it more frequently. And colic is important or good during a kidney renal stone colic, because during the colic phase, during the pain phase, the stone has been pushed each time ahead. As you see in labor pains, the more strong the labor pain, the more child is pushed down. So the child during delivery has to be pushed so that labor be more strong. So you have to give pain during labor to become more stronger. You have colophylum, you have those remedies where the labor pains are weak, so you have to increase the pains. So similarly in renal colic, you have to give remedy to increase the pain so that the stone is pushed out, so that the stone is thrown out. But if the pain is unbearable, then you have to think, make the patient comfortable also. You cannot go against the capacity of the person. So there you have to give a painkiller. Whenever the painkiller is given, the stone subsides there. And that is why during labor, you don't give any medicine to stop the labor pain. Even pitocin are given to hasten the pain so that the delivery occurs fast. If the person is unconscious, medicine can be dropped on their lips, rubbed on the face or on the body. Second way. Third is water solution of calendula. Locally also our remedies are used. Water solution of calendula diluted is 1:10. That 1 part of calendula and 10 part of distilled water can be used to irrigate the wound and dampen the gauze in a wet to dry dressing in order to speed healing. Calendula is one of the best remedies for any abrasion or ulcers, maybe static ulcer or maybe wound due to any injury. Even ulcers of cancers which are occurring in the mouth, we use a mouthwash, calendula mouthwash. If there is a lot of slough which is been there, we give them hydrogen peroxide to have a mouthwash first, or gargles of hydrogen.
Sorry to interrupt, sir. Yeah, please have some water.
Yes.
Yeah.
So for wound healing in cancers of the mouth, you can use, where there is a lot of slough, first hydrogen peroxide cleaning, and then you can put calendula diluted, or maybe in such severe cancers, even calendula a little bit more concentrated, and they should just hold the calendula water in the mouth. That helps very good healing of the wound, local healing, irrigation of the wound, and also dressing of the wound. Then mouthwash, as I told just now, and even nebulization. Nebulization can be done. These are mostly seen in asthmatic patients, where during nebulization, we give our medicine in that cup of water where they add, and they can be nebulized. It gives very good effects. Now you see some practical protocols. I told you protocol is where you just don't think much, but it is something which is very commonly used. So preparing for surgery in uncomplicated cases, you have aconite, arnica, calendula, hypericum, nux vomica, phos, staphyl. While in complicated cases, individual homeopathic treatment is necessary. Very simple. Fear, anxiety, nervousness, acute distress, sleeplessness. You have aconite, argenticum, nitricum, because now here you have to use those remedies according to their keynotes. If you want aconite, everywhere, somewhere, aconite has a role. Try to remember. It's aconite, staphylococcus, hypericum. They all have a role. Hypericum is used where there is lot of nerve tissues involved. When nerves are involved. Like a child is traveling and the window pane falls on the nails or on the fingers. Whenever there is an injury to the nails, it is more of hypericum rather than aconite. So these are simple things that we have to understand, and these are the remedies out of which we have to choose, and we have start working with it. So pain after surgery, aconite, Allium cepa. Allium cepa is known for stump injury or pain after amputation. Cophia, where there is hypersensitivity or sleeplessness. Gelsemium, ignatia, phos, pulsatilla, opium, silica, and spigelia. Nausea and vomiting persist. Arsenic, ipecac, nux, and phosphorus. Constipation, diarrhea, distension, and flatulence. You have again alumina, bryonia, nux vomica, opium, aloes, arsenic, china, carbovage. Raphanus. Raphanus is one of the remedies post-operative for gas which are obstructed. Shock, collapse, and coma. Acetic acid, camphor, carbovage, strontium carb, sulfuric acid, and veratrum album. Hemorrhages, very common. Post-operative hemorrhages or hemorrhages after injuries. Arnica, calendula, china, ferrum met, ferrum phos, hemamelis, ipecac, lachesis, millefolium, and phosphorus. Anesthesia and side effects of anesthesia. Acetic acid, carbovage. So you have a list of wound, scar, sepsis. Arnica, calendula, hepar, hypericum, lachesis, pyrogen, staphylococcus, and thiocyanine. Bedsore, decubitus, a very important challenge where homeopathy can face in all type of bedsore and decubitus with old age people also, where not only internal medication, rather than internal medication, the dressing of homeopathic medicine gives a very good effect. Arnica, calendula, china, fluoric acid, graphites, hypericum, hydrastis. Hydrastis also is a very good remedy where you have a lot of discharges. Discharges from the wound which are offensive, sticky. So wherever a lot of discharges are coming up, hydrastis comes into play. Lachesis, where you see the blueness of the ulcer. You have pain where the touch of even the cloth aggravates, and edges of the wound. All those things should have to be seen during this bedsore or like what we can say ulcers. Leadum, sulfuric acid, and zincum. Surgical fevers. Surgical fevers. In fact, with surgical fevers, we have prepared or we are trying to talk with these hospital people where post-operative homeopathy should be given. With all these details that we are having, post-operative medications or post-operative homeopathy, if they are used, their painkillers can be used much less, and people going into renal failures can be much less. So one of the cause for renal failure post-operative is the severe medications that has been given, mostly painkillers after surgery is the cause for it. Bronchitis or pneumonia, urinary troubles, a main cause for during acute kidney colic or chronic kidney colic. Lycopodium, berberis becomes a very good remedy. So you have one more remedy. I'm forgetting the name, I'll tell you. Paralytic or post-paralytic operative ileus, arnica, carbovage, opium, nux vomica. Lack of reaction, carbovage, sorinum, weakness and prostration. So these are something we have to see. Now, painful feet from standing, tender feet of shop girls, very common. You see a lot of malls, these girls stand the whole day, and they also use a high heel. Squilla is the remedy for such painful feet for standing a long time in shops. You have wounds. If we'll see a very common topic of wounds, scars, and sepsis. Epis will come to the rescue in picture when there are puncture wounds that become very sensitive to touch, red, swollen, edematous, and painful. The wound is hot and the pain is usually burning, stitching, or piercing and continuous. Cold application ameliorates. The redness may spread like erysipelas, and erysipelatous or lymphangitis may develop from wounds or after operations. It has to be compared to lachesis. And what will be the lachesis? It's the blueness will remove or take away epis and put forth in fourth lachesis. But epis will not have that blueness, while it will be more red swollen. Both have sensitivity to touch. Carcinosine is reportedly helpful for keloid scars from plastic surgery and reduces the incidence of keloid scars if given preoperatively. Gunpowder is one of the best remedies for sepsis, septic suppuration, and blood poisoning. Use low potencies. Gunpowder is also very good for cancer of the alveoli, pain for the cancer of alveoli, mandibular pain or alveolar cancer, alveolus cancer, where gunpowder is using or gives much good effect. Myristica sabifera is also a remedy of great antiseptic powers. It hastens the suppuration, shortens its duration, and is a good medicine for stubborn abscesses. It's of value in the treatment of skin, cellular tissue, and periosteum, and for the treatment of abscesses, suppuration, and traumatic infections. The tongue is white and cracked, and there is coppery taste. Now you have to see the generals of myristica. And burning in the throat, hands may be stiff as if squeezing something for a long time. It is called the homeopathic knife, as much as more accurate and faster than a surgeon's knife. So many times surgeon knife can be switched off to because of myristica. Another remedy is tarantula. Tarantula also is a very good remedy for opening up the abscesses. It opens up the abscesses and healing takes place very fast. So you don't need to do an incision and drainage for many of the abscesses and boils with myristica and tarantula, silica, sulfur, and also hiparsal. Calcarea floor can be indicated for adhesions after surgery for old scars that begin and itch. Reabsorption of callosities, fistula, and keloid scars. Hardened muscles, indurated and stony hard glands with threatening suppuration as well as bone exostasis are other characteristic features of this remedy. Calcarea sulf will be helpful in suppurating skin. Now, what is the importance of calcarea sulf? The moment you see a abscess, you should be able to, or face of calcarea sulf, you should be able to say it is calcarea sulf, because they are very much, the face is very much, what we can say, sticky, and there are a lot of pimples, or anywhere the boils or abscesses are there, they are very much yellowish color is there, thick yellow color, and it also cures fistula, suppurating fistula and old discharging wounds. The look of the wound or the face or the area is very much dirty look. Whenever you see a dirty look, which you have to think of calcarea sulf very strongly. Thiocyanamine is a specific remedy to dissolve scar tissue, adhesions and strictures. It's a valuable remedy for keloid scars. Here also think of carcinosis, silica, and graphites. So these are some of the remedies in wounds, scars, and sepsis. So if you go to radar repertory, if you see this is a radar repertory, you have in all these chapters, if you see 24 or 25 chapters, they are there. All chapters have pain. There are only 2 chapters which don't have pain in them. One is hearing and the second is urine. These are only 2 chapters which don't have pain as a rubric in that. But all other chapters, including mind and also dreams, I've given you dreams, pain abdomen, pain arm, pain back. So if you see dreams, there also you have pain. So homeopathy is that specific for pain. So you have to go into chapter and find out the different modalities, types of pain, so that you can come to the accurate understanding of pain and the remedy for it. So it was not easy to give you. So that's why I've given you a general idea that pain is in each chapter. Pain is very common, and we have to go very deep inside to understand the type of pain, the modalities of pain. Fistulas have increased very much. Piles have increased very much. Fissures have increased very much, which are not responding to allopathic treatment or partially plays an important role, but pain is the main issue that should be solved first. So you have to go to the chapters, find out what is retagnia, what is peonia, and what is sulfur, and what is natropur. So this is how you have to go into this system and further initial phases of pain management or understanding. Now, if you have any questions, you can ask your query. Share you pain and its management with, first we are understanding pain and then we are trying to manage with homeopathy. So I'm again thankful to Kavita and the whole team of our KHA group, because they are always on their toes. Shweta, Nupur, I'm forgetting some names, Srivalli. So they are always on their toes to help us to deliver our work very meticulously, and because of them we are very much safe and always on the forefront, but they are working backhand always. So I'm thankful to all our group members of KHA family and also Kavita. So final thanks to the participants today. Being Diwali vacation, still they are in the Diwali phase and the New Year phase, or still they have joined being a Sunday also. So a heartful thanks to all these participants. If any questions are there, I'll be happy to give my answers. Thank you once again, one and all. Yes, Shweta.
Thank you so much, sir. Thank you so much, sir, for such a enlightening session. It was really wonderful. And we have with us our KHA volunteer, Dr. Yashika Arora. Dr. Yashika, are you there? Please start your screen. And if there is any question, please raise them to the speakers. I think she is not with us, so I'll be taking up the questions, sir, for you. And there's one question from Dr. Mohammed Muzammil. Is there any specific potency to control acutes of musculoskeletal pains? Am I audible?
Now, yes, yes.
Yes, please, sir.
The question of potency is always raised. The answer to this is, during acute, if the cause or the symptoms are very clear, like there is a history of fall and you have to give arnica. So here 30 arnica is not helpful. Here you have to give 1 m 10 m arnica. Now, when you are talking about fibro, what he said? He asked for which? Fibromyalgic pain or musculoskeletal pains? Now,
Yes, sir.
if it's an acute musculoskeletal pain, like the person had an accident, he had an abrasion or concussion, then definitely high potencies are useful. But musculoskeletal pain of a chronic nature, he's coming with a rheumatoid arthritis, he's coming with a ligamental tear, he's coming with a sprain, acute sprain. He lifted something and he has an acute back pain or a back sprain. So here high potency is more than 200 with repetition. During that phase, high potencies between 200 to 1 m can be given and frequently repeated also every 3 hourly or 4 times a day, 3 times a day can be repeated. But if it becomes once a chronic situation, then you have to go with the individual characteristic, which will take care of the pain as well as the pathology. I hope, Muzammil, it's clear.
Yes, sir. Now we have with us Dr. Yashika Arora, and she'll be taking questions from the chat. Over to
Thank
you,
you
Yash.
so much. Thank you so much, ma'am. There was one question previously before the potency. It was nowadays from Dr. Mohammed Muzammil only. These nowadays epidural nerve blocks are common in allopathic practice, but is still not effective and helpful to patients. How does a homeopathic practitioner or what is the role of a homeopathic practitioner in such post-cortisone shots? So over to you.
Now, post-cortisone shots are two ways we have to first see. If they have taken a lot of cortisone before, we have to give somewhere at the first phase cortisone or intermittently cortisone along with the indicated remedy that is coming up for the purpose of what they have given it. Like for the knee osteoarthritis, they generally give a cortisone shot, and then after some time the pain returns back. But many a times they are helpful. So after giving intra or the post-cortisone injection in the joint, if they are relapsing, you have to take care. One, you have to give cortisone and our remedy, or then you have to give the individual characteristic remedy. I hope. Is it clear, Muzammil?
Thank you so much, sir.
That is what I think is the question is. Intra-articular shots that given, intra-articular shots he means, no? In musculoskeletal diseases.
Thank you so much, sir. Dr. Shweta Verma has also posted a question, which and how can a medicine used in nebulization? She's asking about nebulization. Can you please explain?
Our medicine is used now in the nebulization machine. Whenever there is a cup in which a water is taken, and in that water usually the allopathic medication is dissolved. Like mostly it is used for asthmatic situation or difficulty in breathing. So what we do, in that distilled water, we have to put our drops of medicine or our globules of medicine. Suppose we are giving arsenic. So orally also you can give arsenic, and in that nebulization cup of water that we add homeopathy, we should add our medicine, and it should be nebulized, or the vapor should be taken as taken by the allopathic medication. So that is the way of nebulization. No different way of nebulization. We have to add our medicine rather than allopathic medicine.
Thank you, sir. I hope it's clear to ma'am. Next question we have from Dr. Sanjeev Aggarwal, sir. How about Angestra for bed sores and strontium carb for post-surgical cases? Can you please comment, sir?
Indication of strontium carb only will help at that juncture. There has to be some symptoms of strontium carb in that case, maybe as a general strontium carb rather than a local strontium carb. The generality of the patient of strontium carb should be there. Strontium carb is a very good remedy for pains, especially the ankle, recurrent ankles which are sprained. So you have some musculoskeletal situation in strontium carb, which if it covers the patient, strontium carb will be helpful.
Thank you, sir. We have one more question from Dr. Kunayan Siddiqui. Sir, when to give tautological prescription? Can you please recommend your views?
we can use tetopathy wherever we have seen that the patient has taken. I have not used much, but my understanding about tetopathic medication is whenever they have taken those remedies very frequently, we can use that as a remedy first rather than our remedy, because they remove that blockages tetopathy that they have taken before. To remove that blockage, we have to use it as tetopathy there.
Thank you,
This is
sir.
my understanding.
Thank you, sir. One more question from Dr. Rekha. What is the role of nosodes in pain management?
See, nosodes are always helpful. There are two ways in which nosodes can be used. One way is the remedy comes as a direct remedy during a totality of symptomatology. Like you see, you thought of thuja. When you are talking of pain management, thuja. Thuja comes up mostly with the pain in the joints or pain in the teeth, where you see the caries of the teeth, crown is carried, and there is yellowness. The face is pale, oily and greasy, and he has, if the nails, you see the nails are also distorted, and the patient has a wet weather aggravation. So here thuja will come as a direct remedy for the patient because it covers much of the generality as well as the local pain of the tooth. Okay. When it will come as an intercurrent remedy, whenever you have given the regular remedy, the totality of the remedy, totality of the symptoms remedy each time, and you are getting a relapse. Whenever you are getting a relapse, then you have to think nosodes as an intercurrent remedy. That time only nosodes will come as an intercurrent remedy. Medorinum can come in many of the rheumatoid arthritis cases, where medorinum can come as the first remedy rather than an intercurrent remedy. But during the first remedy, there has to be symptoms of medorinum. Like there should be better at sea, their pains are more better at sea. You have a past history or family history of some severe illnesses, family history of early heart attacks or heart diseases. Then in the patient itself, lying on the abdomen, desire for fat, desire for salt, nail biting, all these things should be there. Mentally, the patient should be very aggressive. All these things, if they are there, they can be a first remedy. It's not that. That's why nosodes as such has come in homeopathy when Hahnemann started getting failures, not failures, the relapses. Patient was better and is coming back after 1 year or 2 years. And then he thought, why where there are relapses after giving a good selected remedy. Then he came into the picture, the nosodes came into the picture. Nosodes did not come on the first time. So nosodes are always to be thought of when you give your first prescription correctly and you are getting relapses again and again, then you can think of nosodes. Hope it's clear.
Also, sir, I want to share that we get to get good results. Like if the similar medicine is not acting at a point, and there is a stage where we feel that medicine is right, but yes, the patient is not responding. Then also I've seen the use of nosodes at a very good with very good results. So at that moment also we can use nosodes for pain management. Thank you. Thank you, sir. There is one last question from Dr. Sanjeev. Cancer pains are most challenging. Did you treat any such case with success? If yes, please discuss. If you want to share any case of cancer.
Cancer have been very challenging. Cancer treatment has been a very difficult affair. Now, we had the role to visit the cancer unit here where they keep terminal cases. terminal cases of cancer where pain is only the criteria to be resolved or treated. After giving them morphine, medications through injections or oral medicines of morphine, yet the people or the patients of cancer don't sleep, or they are still in agony and pain. So in all those terminal cases, pain is the only way, pain is the only criteria that has to be resolved. They are out with the pathology that cannot be treated. So we had a little bit of, because we had approached them and said that homeopathy has a role in cancer management and cancer treatment. So we could see cases where our morphine, we treated some cases, we gave our remedies, but we could not go much ahead because they did not allow us much to do work there. But we are definitely trying for that. But some remedies that have helped during that phase are Naxwamika is one, where because of lot of treatment, patient has become more of hypersensitive and sensitive. And at that stage also, they are hyperactive and irritable. So in those cases, Nux has given them some sort of relief, definitely, for a day or two. It is not that you give Nux and the pain went away. No, no. They were relieved for 24 hours, 48 hours, a day or two, where repetition of Nux needed to be done again, where giving morphine also was not helping them. Nux vomica helped them. Coffea was one more drug. Our drug morphine also helped them a lot. So some drugs we have tried, belladonna in acute, where repetition of belladonna here mostly millisimal potencies are more helpful, are very minimal, and we can give them repeatedly from 0/1 to 0/2, 0/3, 0/5. So millisimal scale is one which can be used much. And in a routine clinic patients of cancer, as I said, Hekla lava is very good for gunpowder and Hekla lava for mandibular, all bone pains. Much of the bone pains, Hekla lava and gunpowder, they are good remedies. Belladonna 3C also is very good for abdominal pain or pain of the tissues. They definitely help, no doubt. They need allopathy. It's not that we give homeopathy and they don't need allopathy. But the amount of allopathic medications that they were needing, like 3 or 4 per day, is reduced to 1 per day or 1 per 2 days. Alternate day they take. So definitely homeopathy has a very good role. We have thus trying to manage our friends here in Sholapur. One for post-operative pain management, and the second is for cancer pains. But still, we are not that successful in making them convinced that we will definitely work together. So, tit by tidbits, we are getting some patients, and we are trying to work with it. So, this is how cancer and homeopathy, or pain in cancer and homeopathy, we are trying to find out and learn more and understand more and try to get more patients for them.
Thank you so much, sir. We have 2 more questions from the audience. Can we discuss, ma'am?
Yes. Yes.
Okay,
Yes,
thank you so much, sir. We have a question. In case of many medicines taken, sulfur would clear the way to start the appropriate remedy. Can you please comment on this, sir? Sulfur would clear the way to start appropriate medicines when there are a lot of medicines being given to the patient. Please share.
You see, sulfur will come only when after a lot of medications have been taken. And whatever you see today as the totality, sulfur comes up very clearly. Sulfur is a remedy which is known as common denominator in homeopathy. Common denominator, because in all cases, sulfur somewhere will be seen, always, much of the time. So sulfur is known as common denominator as homeopathy. So if after giving a lot of remedies, after the patient is coming to you with a lot of remedies, and you want to give sulfur, you should have some very peculiar, strong symptoms of sulfur. Definitely it will work, no doubt. But if there are symptoms of sulfur, because sulfur has many symptoms, that is why common denominator. So it will have burning, it will have skin eruptions. All skin eruptions will be there in sulfur. So just having skin eruptions will not be sulfur. Try to understand. Just having burning is not sulfur. So you have to have some peculiarities of sulfur, like hunger at 11 a.m. He should be very much lazy person. He should be having craving for fat, craving for sweets. There has to be a change in the craving system. He was not liking sweets before. Now, after all the remedies that were given, now he is having craving or desire for sweets more, desire for fat more, hunger aggravation, 11 a.m. aggravation. He is having aggravation from heat, or he is a hot person. All those things, if they are very strongly clear in the case, then you are entitled to give sulfur. Otherwise, no. Just because he has taken a lot of medication, can I give sulfur? No. There are other remedies also. Naxvomica is there, sepia is there. Best is a cell. Give a cell. Wait. Why you want to give sulfur? Still adding more to the already done mischief. Wait. Don't give anything. Give a cell. Things will move. If something acute is coming, only treat that acute. They are coming for severe pain. They are coming for severe itching. Treat that itching. Now, in that itching, you will have to modality. Now, ringworm people are coming so badly. We are having patients of ringworm like anything. Allopathy has not helped them. A lot of suppression has done. They have taken a lot of flunicasol, applied many things, and still they are coming. Now, what shall we do? Now, one patient of ringworm, which was very much resistant and was suffering last 2 years, was given syphilinum. Nothing as syphilinum. What was destruction? Nothing was destruction. But his way of saying of symptoms, syphilinum helped him, and he was out with syphilinum 1M. After many days, he was asymptomatic. So that is the beauty of homeopathy, and that is what homeopaths have to learn. Try to understand. I'll tell you again and again. Homeopathy is very simple, but at the same time, it needs a lot of finer understandings and differentiation. If you are able to and once you do that, you will never forget in your life. And then you will see you can give any remedy anytime. Many times they say sulfur not to be given in skin conditions, but even severe bad aggravated skin conditions are treated with sulfur, and the patient will be much better. Sulfur is good as well as bad. Good when given correctly, bad when given wrong. But what is correct and what is? Both in the ways of Mater Medica and in the ways of philosophy. Then it becomes very simple. Okay, I think it's clear.
Thank you so much, sir. It's absolutely clear. Thank you. One last question. What is the role of external application in homeopathy when we talk about pain management? Can you please summarize in short? Role
of homeopathy locally
external
in pain management. External application is very limited. Is limited to wounds, dressing of wounds, and application only when the patient is unconscious or unable to take the medicine orally. Now, for the wounds, wherever there is an abrasion of the tissues, calendula is best internally as well as externally. We have to clean it first with water, needed hydrogen peroxide also, and then you have to drip it with auspice with calendula, but that calendula definitely has to be diluted. 1:20 or 1:10. Otherwise, it gives a lot of burning. So be careful while using locally. It has to be diluted 1:10 or 1:20. First, put a little bit of calendula and see how much it burns to the patient, whether the patient is able to tolerate or not. The second is in any wounds of cancer. The third is when the person is unable to take. He had a history of fall, and then the patient is unconscious. He is put on a ventilator. You cannot put the medicine because the whole mouth is also blocked. At that time, you have to rub it on the skin, on the forehead, on the face, or wherever you can be able to apply arnica. Whenever there is injuries of the nerves, more of the nerves, as I told you, hypericum will be more useful rather than arnica. Whenever there are punctured wounds, ledum pal is more useful than hypericum or arnica. You see people coming with pain. They had asked me a question of post cortisone injection. Now people come with multiple lumbar puncture. A lady comes with multiple cesarean sections, and each 4 or 5 cesarean sections, and each cesarean section she was given what? Anesthesia, the lumbar anesthesia, and they come with backaches. Okay, so backaches which are coming after post 5 or 6 lumbar punctures or cesarean sections, the first remedy is ledum, not any other remedy. By default, you can give ledum and then you can give your remedy, because 5 times she was lumbar punctured, and then she had an so all these things will come only when local application has a very limited role, generally with the wounds, to cleanse the wounds. In all the ulcers that are there, bed sores that are there, calendula is the best remedy which can come up with very good result.
Thank you
Anything
so
else?
much, sir. Thank you so much, sir. I hope the answer is clear to the audience. And I would like to request Dr. Shweta ma'am to proceed further with the webinar. Over to you, ma'am.
Thank you, Ashika. And Dr. Ashok Madan would also like to ask. So, yes, sir, please unmute yourself.
Good evening, Dr. Aggarwal. Hello.
Yes, sir. Good evening.
Good evening.
Sir. Good evening.
Namaskar. I have simple question to ask you. You were talking about LM1 or 2. In case of animal remedy, could be lachesis. It could be used, or in your practice, in your experience, rather than to give a single dose, as usually we do it, that can be used in LM potency also, starting from 1 or 2. I hope I was able to explain my question. Dr. Aggarwal.
Voice break in between. Lachesis 0/1 can be used or cannot be used. What?
Yes, normally you prefer yourself in your experience only the C single dose, or you can use or could be used this LM potency for lachesis.
We can use LM potency of lachesis without any difficulties. Whenever an indication and we feel that lachesis 30 or 200 also will be definitely more stronger to the person. Where there is a sensitivity more, we can use lachesis 0/1 or 0/2. No issue.
Oh, okay. I'm asking because of the severity of the patient is serious, but 30 to wait for, or 200 to wait for, or 1000 to wait for sometimes get a lot of time to wait. Rather, the patient is necessary to be repeated the medicines. For that reason, I'm asking for LM.
Yes, LM also during an acute phase beautifully, because rather than the chances of aggravation are less. So in those
Yeah.
serious conditions, serious conditions, LM1 repeatedly can give you much better results rather than 30-200 or 1M. Because in those
Fantastic.
cases, the aggravation can give a more bad effect rather than a good effect.
Right. Thank you, Dr. Aggarwal. Thank you very much, really, because I was dealing something, so I was wanting to. Thank you very much. Namaskaram.
Thank you so much, Dr. Hira, for patiently answering all the queries. And it was really a great learning and a nice description of pain with the management. And for this, we would like to take privilege to honor you both with the KHA Appreciation Certificate. Please accept it from KHA Homeopathy Study Group team. Congratulations, sir.
Thank you.
This is for Dr. Nupur. Congratulations, Dr. Nupur. So with your permission, I would also like to announce the upcoming webinar this on 4th December 2022 at 8:30 p.m. India and 10 a.m. Eastern US and Canada. We will be having Dr. Mamta Kumar and Dr. Shweta Verma with us, and they will enlighten us on the topic homeopathic management of asthma in children and Coculus indicus and its homeopathic approach in cervical spondylitis cases. So you can register for the webinar and you can find the link at our website kavitakehomeo.com. And I would also like to thank our speakers of the day, Dr. Hira and Dr. Nupur, for their precious time and for the enlightening sessions they have given. And do you have anything, Dr. Yashika?
No, ma'am. We need to read the ethics.
Yes, I would also like to request Dr. Yashika to read the code of ethics.
I think I have the file, ma'am. Can I just announce it? Like I've
Just read the ethics. Yes.
can we share? Can I share my screen?
Yeah, sure.
Wait a minute. Yeah. Is it visible, ma'am?
Yes, Yashika.
Thank you so much, Dr. KHA Homeopathy Study Group. It's a great privilege for me to be a part of this family, KHA Homeopathy Study Group. And I'm glad that I have this opportunity today to read our code of ethics and the benefits of KHA Homeopathy Study Group pro bono. So as you all know that the website which belongs to us is www.kavitakehomeo.com, and the code of ethics are read as follows. To be a KHA speaker, it needs at least 1 to 2 months active volunteering. Only KHA speakers' themes are promoted in newsletters and webinars. KHA provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and also added to our WhatsApp groups. Articles of volunteers will be posted on KHA website and newsletter and will be sent for publication in other journals as well. Volunteers and speakers are eligible for prestigious KHA annual awards. Volunteers are eligible for KHA inspirational talks. Volunteers are also eligible for case discussions. KHA promotes homeopathic organizations as well as their mega events. KHA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KHA maintains a healthy and happy environment, so keeps only like-minded folks. And KHA requests everyone to maintain the confidentiality of the group. Thank you so much. I hope the code of ethics are clear to you all. Now I would like to hand over the session to Dr. Shweta ma'am to end the event. Over to you, ma'am.
Thank you so much, Yashika, for reading the code of ethics. And now I would like to thank our speakers for their gracious presence and for their precious time in sharing their knowledge and wisdom. And I would also like to thank our mentors and volunteers who joined us today, to name Dr. Deepak Sharma, Dr. Shweta Verma, Dr. Poonam Chavlani, and the entire team of KHA Homeopathy Study Group for their continuous support and selfless work. And thank you to the viewers for joining us today. And if you want to see the recording of the previous webinars and today's webinar, you can subscribe our YouTube channel with the name Kavita Kukunod. And for the upcoming webinars and any other details, you can also see our social media handles like on Instagram, Facebook, Twitter, and LinkedIn for the details, and with the name KHA Homeopathy Study Group. And for any other query, you can reach us at KHA Study Group at gmail.com. Thank you all for joining us today. And please don't forget to fill the jot form to receive your participation certificate. It will reach you by within a week or by 10 days. And thanks a lot for joining us. We are ending the session now. Thank you. Thank you all.